So welcome to my session today, and I'll be talking about healthy aging with integrative medicine. I'll introduce balance to you at the end of the session if we have some time, and if you have any question about balance training in residency training programs in medicine. So basically your questions are welcome anytime during my presentation. So I hate didactic lectures, so it will be an interactive one, and you're most welcome to ask anytime. So any question before I start? I will come to this. Okay, so at the end of this presentation, you will be able to define complementary, alternative, and integrative medicine. You will be able to recognize the health effects and risk of some herbal products and supplements. You will become familiar with the various types of mind-body practices. You will be introduced to complementary health services used in some diseases that affect seniors. You will be able to practice mindfulness exercise, and you will be introduced to our EUB Health and Wellness Center. So allopathic medicine, as you all know, is the system of medical practice which treats disease by the use of remedies which produce effects different from those produced by the disease under treatment. So this is what we medical doctors do. So traditional medicine. Folk medicine refers to therapies that are provided by family or group members as part of a family or cultural tradition. So it's part of a culture, and it uses usually native remedies. Now, complementary versus alternative medicine. Complementary generally refers to using a non-mainstream approach together with conventional or traditional medicine, and alternative refers to using a non-mainstream approach in place of conventional medicine. So how about integrative medicine? So this is the move. We used to say complementary and alternative medicine. Now we use complementary and integrative medicine. So it combines both mainstream medical therapies and CAM therapies for which there is some high quality scientific evidence of safety and effectiveness. طب ما بقى نقول CAM يعني زين الأتات. So even in US, the National Center for Complementary and Alternative Medicine changed its name to the National Center of Complementary and Integrative Health. So integrative medicine and health, it reaffirms the importance of the relationship between practitioner and patient, and it focuses on the whole person rather than on the disease itself, and definitely it's informed by research, studies, and evidence. It makes use of all appropriate therapeutic effects and lifestyle approach to achieve optimal health and healing, and it addresses the full range of physical, emotional, mental, social, even spiritual and environmental influences that affect a personal health. So what are the IH? I mean by IH integrative health categories. The first category is natural products. I mean herbs, vitamins, minerals, and probiotics. The second one is mind-body interventions, yoga, such as chiropractic, meditation, massage, acupuncture, relaxation technique, guided imagery, Tai Chi, Qigong, hypnotherapy. And the other complementary health approaches are homeopathy and Ayurvedic medicine. So how many of you use complementary and alternative medicine in general? In general, all categories. I mean natural, mind, body, everything. Okay, so almost like 50, 60, 70%. Herbal only. Herbal products. Okay.
Not only.
What about vitamins? Most of 90, 100%. Okay, so in US they did a big national survey and they found that the 10 most common complementary health approaches among adults are natural products, deep breathing, yoga, Tai Chi, and Qigong. Then chiropractic, meditation, followed by massage, special diets, homeopathy, relaxation, and imagery. So how about us in Lebanon? So a study that was done 3 years ago showed that most of the Lebanese population, mainly in Beirut area, use folk herbs as medicine or as treatment, and 13.2% used folk food, whereas 3.8% only use vitamin and mineral supplements, and 31% use natural health products. So this is quite common.
What is folk?
So I define fold is that traditional medicine prescribed by neighbors, by families, and it is usually guided by culture rather than by research. So it's not backed up by evidence. يعني if you have stomach ache then بغلي نعنع مرشحة بعمل soup. So this is folk medicine. It's not backed up by science or by evidence. وصفات شعبية بالعربي. True. Which one? The folk medicine? True. This one?
Yes.
Okay. So this one is the use of complementary and alternative medicine among Lebanese adults, and this result was from a national survey. So 75% of people use folk herbs, and 13.2 food, 3.8 vitamin and mineral supplements. I'm talking basically mainly about healthy and sick people, and not only sick people. So I will start with the first category, which is the natural products. So many older adults are turning to complementary and integrative health approach to promote their health and well-being, and they are often sold as dietary supplements, frequently used without prescription, despite some safety concerns and lack of evidence to support even their use sometimes. It can contain pharmacologically active compounds that may interact with prescribed medicine or have side effects and risk. So what are dietary supplements? They are intended to supplement the diet. They contain at least one or more dietary ingredients. I mean vitamins, minerals, herb, botanicals, amino acids, or their constituents. Herbal supplements are one type of dietary supplements, and research has shown that some use of dietary supplements are beneficial to health. Natural does not mean safe, of course, and some dietary supplements have found to interact with lots of medications. I will go over a few supplements, over a few vitamins and few minerals that are useful to our well-being and health. So how many of you use omega-3 supplements? Okay, so interesting. So you'll have some interesting facts. So what are omega-3? Yes?
Omega-3, how many pills can one take a day?
I will come to this very soon. So what are omega-3? They are a group of polyunsaturated fatty acids that are important for a number of functions in the body. They are in some foods such as seafood, mainly fatty fish, olive and canola oil, and they are available over the counter in dietary supplements form. What about facts, research, and studies? So studies, conclusions are really inconsistent. So seafood rich in omega-3. When I mean seafood rich, I'm not talking about supplements. I'm not talking about pills. I'm talking about eating fish. It should be included in a heart-healthy diet. And people who eat fish at least once a week are less likely to die of heart disease than those who rarely eat or never eat fish. But supplements did not show protective benefit for heart disease. Okay? Some evidence that seafood diet relieves symptoms of rheumatoid arthritis, but not supplements. Okay, so I'm talking about the effect of omega-3 found in the food. People who eat diets rich in seafood are less likely to develop the advanced stage of age-related macular degeneration. This one is an eye disease that can cause some vision loss in older people. However, a large study showed that supplements containing EPA and DHA did not slow the progression of it. So again, seafood rich in omega-3 is very helpful to prevent progression of this eye disease. However, supplements did not show benefit. So supplement rich in EPA and DHA did not slow cognitive decline in older adults as well. So now, do you still want to take pills, omega-3 pills? No. Okay, so there is a recent study that was done like 2 years ago. It showed that taking 6 pills, 2 tablets, 3 times a day of omega-3 6-9 supplements is equivalent to at least eating 2 times seafood a week. So it's better to eat 2 times seafood a week rather than taking 6 pills a day. But if you want to take supplements, usually taking 6 pills is a treatment for some type of lipid disorder. But if you want to take like 1, 2, or even 3 pills, they are not harmful. Okay.
What is EPA and DHA?
They are types of omega-3, some types of omega-3.
Please, what about chia seeds, يعني omega-3 that you find in plants?
Yes, it is the same one available in olive and canola oil. They are polyunsaturated fat, but they are considered as supplements as well. They are not natural, pure food omega-3.
Just 1 pill of omega-3 once a day.
It's not beneficial, not harmful.
Will not help any.
It's not beneficial and not harmful.
But 6 tablets a day is too much.
6 tablets a day, as I mentioned, it's not to prevent a disease or a condition. It's to treat some kind of lipid disorders. Okay, so usually when we talk about prevention, we're talking about like 2 or 3 pills a day. You can take 2 or 3 pills. Maybe in the future there are some studies to prove that they are effective, but current evidence is inconclusive, and studies show that there is no evidence of using them for any health condition. Okay. Olive oil, you can take up either olive oil or equivalent to olive oil. I mean, for every tablespoon, like 3 olives. So you can take up to 5 servings. The one serving is 1 teaspoon. Okay.
Does the can tuna fish have
It counts. Yes, it counts. It counts. The best one is salmon, but tuna fish counts as well as any seafood. Eat any seafood. So what are the precautions of omega-3 supplements? So omega-3 supplements may interact with drugs that affect blood clotting. So if you're taking blood thinners, be aware of taking high doses of omega-3. There is supplements that are fish liver oils, and they are not the same as regular fish oils. These can be toxic in high doses. Okay, fish liver oils. More than 3 pills a day. Consult. So if you want to start taking omega-3, or you want to replace your medicine with omega-3 supplements, then consult your healthcare provider before using the supplements. Yes? Yes?
If we are taking and you eat olive oil or olives or fish, would also interact negatively with the...
It will not. I'm talking about supplements. No. Eating fish and eating olive oil will not interact with any medicine. The only contraindication to take them is the allergy, fish allergy. So do you know what's this?
This is not
طيب راح أعطيكم more hint. So I started with omega-3 because it is popular to use among seniors, and this one is very popular as well. No? It's used for memory, for tinnitus, to improve cognition. I will be talking about turmeric, but it's not. So this is Jinko Biloba. Okay? It's my Jinko Biloba. So it's kind Jinko Biloba. Eh? This is a supplement available over the counter as well. Okay, so Jinko Biloba, usually it's extracted from leaves and used as a dietary supplement as well. And the evidence is inconclusive if it is helpful for any health condition. It doesn't help prevent or slow dementia or cognitive decline. And there is no strong evidence. When I mean by there is no strong evidence, there is little evidence that Gingko helps with memory enhancement in healthy people, blood pressure, intermittent claudication, tinnitus, age-related macular degeneration, and it decreases a bit the risk of having a heart attack or stroke. It is very common, yeah. Pills, supplement pills. So what are the risks of Jinko Biloba? It's safe when taken by mouth in moderate amounts. Side effects, headaches, stomach upset, and allergic skin reaction. It may interact with blood thinners, and it may cause increased bleeding tendency. Raw or roasted Jinko seeds can be poisonous. Now turmeric. Do you know turmeric? Yes. The family, yes, the famous one. So turmeric is a plant related to ginger. It's an Indian one. And curcumin is its active ingredient. So omega-3 supplement is not that helpful. Jinko Biloba as well, but here I have some good news. Because we have preliminary evidence that it reduces the number of heart attacks for bypass patients who had surgery. It helps in controlling knee pain from osteoarthritis as well as ibuprofen did. And it reduces the skin irritation that often occurs after radiation treatment for breast cancer. So it has some anti-inflammatory effect. Yes?
How do you recommend to eat?
Pills. It's available. Pills, yeah, it's available.
It's fresh, the powder.
The powder is better, but we don't know the active ingredient in the powder prepared here in our بالمطحنة وهيك أشياء. So we don't know the active ingredient. Yes. Okay. So some.
And then we'll have questions all at the end. Yes.
Keep questions till the end. Okay. I don't mind either.
Keep the questions till the end, please.
Okay. So turmeric is generally safe, but high doses cause GI upset. So always consult your healthcare provider before taking turmeric. So what about Co-Enzyme Q10? If you want the presentation, then definitely I will be sending the presentation to everyone.
Hello everybody. Questions till the end. Please let's allow Maya to finish.
This is not fair. This is not fair.
No.
Let me have a
Let's allow.
question related to this point.
It's okay. You can keep it till the end. Questions till the end, please.
Or what we can do is take 1 or 2 questions after each topic.
Trust me, will not finish.
Okay. You're the expert one here. Okay.
You can write them down and keep them till the end.
Stomach upset, stomach upset, yeah. So what about coenzyme Q10? Are you familiar with this one? Yes, okay. So beneficial effects on patients with congestive heart failure and patients who have cardiac ischemia. It is not effective in improving performance, retardation of the aging process, immune system. It doesn't affect diabetes mellitus scores. It's not useful in hypertensive patients or in cancer. So the only benefit is in congestive heart failure and ischemia. It can affect patients who take warfarin and statins as well and make them less effective. So cranberry, early studies showed that it helps in preventing recurrent urinary tract infection. However, recent data showed that it is not effective either in preventing or treatment urinary tract infections. Okay, shocking, right? However, it has some benefits in preventing or reducing dental plaque and in reducing the ability of a bacteria found in the stomach, Helicobacter pylori, to live in the stomach and cause ulcers. So it has some benefits on stomach and dental plaque, but not on the urinary tract. Echinacea. So it has immune stimulating effects. However, there is no evidence on treating or preventing common cold. How about garlic? Do you know if it is beneficial or not? Okay. So there is one study that showed that short-term use of garlic, I mean 1 to 3 months use of daily garlic, has some benefit on blood cholesterol levels. And there is a big, huge study that was done in Japan that showed that the higher the amount of garlic consumed with food, the lower the risk of stomach and colorectal cancer. Okay. Melatonin. So melatonin is also a supplement. It's effective in jet lag and shift work disorders. It is not effective in treating most primary sleep disorders, and it is safe with short-term use. So if you have like insomnia, not related to any other disease or condition, then you can try melatonin. It is safe. Honey. So honey is effective in treating cough more than diphenhydramine. Okay, so now is the common cold season. So if you don't have any contraindication, such as diabetes, to take honey, then you can take up to 1 tablespoon of honey 3 times a day if you're having cough. Amani, yeah, بدك honey. Okay, how about wounds? So some studies have found that it heals the wounds heal around 4 to 5 days more quickly than conventional dressing. So if you put honey on the wound, then it helps with the healing process faster than the regular dressing used. It is more effective than antiseptic, followed by gauze for healing wounds infected even after surgical operation. And now in the medical field, we have already honey gels. How about zinc and common cold? I'll be talking a bit about common cold since it is a season, yeah. Zinc, supplement, vitamin. Do you take zinc? Okay. So if zinc, if taken with a dose around 75 milligram a day, if given within 24 hours of starting the symptoms of common cold, it can help decreasing the duration of cold, and it helps alleviating the symptoms of common cold. So if we have like a mild sore throat and mild runny nose, and we start the zinc 75 milligram a day within 24 hours of starting the symptoms of common cold, this will help us relieve the symptoms, and it will lessen the duration of common cold. However, there is no firm recommendation to take it to prevent common cold. So it helps treating but not preventing common cold. And it's available over the counter in all pharmacies. At AUBMC, we have it in solution form. Vitamin C, it has no effect on preventing or treating common cold. So throw it away this season. So yes, it has no effect on the common cold. It helps boosting the immunity of patients sick, of patients residing in the ICU unit. It helps with lots of chronic disease, but not in common cold. How about probiotics? So studies have also found that probiotics prevent common cold. So if you take probiotics during the winter season, like 3 or 4 months, then it will help prevent the attacks of common cold. So now I'm almost done with the herbal part. I will move to the vitamin parts. So do we need extra vitamins to take? First, we have to take vitamin D. For people between 50 and 70 years of age, it's recommended to take at least 600 international units. And for people more than 70 years of age, we recommend using at least 800 international units. The maximum dose is 4,000 international units a day. Yes, so 600 international units a day, yeah.
Only 3 days ago on the AUBMC Instagram, they used that don't take supplementary or vitamins.
It depends on the condition, and it depends on the age. So food rich in vitamin D are fatty fish, fish liver oils, and definitely fortified milk and milk products and fortified cereals. In our country, we have a few fortified milk in vitamin D. The cup is around like 100 to 150 units. So 1 cup of milk has 100 or 150 units of vitamin D. So if you're not taking from your food, and it's like very unlikely to eat fish daily, so it's better to supplement with vitamin D. Vitamin B6, it is needed for everyone. Usually we need 1.7 milligram for men and 1.5 milligram for women, and it's available in fortified cereals, whole grains, organ meats like liver. We don't need extra vitamin B6 if we have a balanced diet. How about vitamin B12? Our body needs 2.4 microgram every day. It's available in fortified cereals, meat, fish, chicken and milk. Some people over age of 50 have trouble absorbing the vitamin B12 naturally found in food. So these category of people may need to take extra vitamin B12. So far we have to take extra vitamin D and extra vitamin B12 for selected people. For folate, we need 400 micra each day, and this is available in dark green leafy vegetables, spinach, beans, and peas, fruit like orange and orange juice. Multivitamin after 70. Should I take it? Multivitamin, the big Centrum one. Okay, so I will tell you what the science says. So multivitamin before 70 is not recommended. However, after 70, it may prevent cancer only in individuals with poor or suboptimal nutritional status, and there is no benefit of taking multivitamin in preventing cardiovascular disease, cataract in eyes, and it may prevent advanced age-related macular degeneration, the eye disease I talked about previously, and this is only in high-risk individuals. So what about calcium? So calcium is a mineral that's important for strong bones and teeth, and people over 50 should take around, for women, should take around 1,200 milligram each day, and men aged between 51 and 70 should take around 1,000 milligram a day. Our Mediterranean diet is really rich in calcium. For example, 1 cup of yogurt contains 450 milligram of calcium, so half of the daily required dose. So if you take like 2 tablespoons of labne, 1 yogurt, then you're done with your required dose. There's no need to take supplement. So you have to see how many calcium you're taking a day and adjust it accordingly to take the supplement pill. Now, herbs and interaction with medications, as I said, supplements can increase or decrease the effects of medicine. For example, St. John's wort decreases the efficacy of benzodiazepines such as Xanax and Lexotanil, and it decreases the amitriptyline level. Amitriptyline is a medication usually taken for depression. So I have a few herbal preparations that can cause prolonged QT. QT, this related to the electricity of the heart, and it may cause significant risk to cardiac patients. So if you have any cardiac disease, beware of taking aloe vera, bitter orange, echinacea, Jinko Biloba, ginseng, hawthorn, licorice, and St. John's wort before consulting your doctor. So what herbal to avoid if you have cardiac disease as well? Ginger, because it causes bleeding if used with warfarin. So if you're taking blood thinner medicine, warfarin, be aware of taking ginger. And licorice. Licorice can cause high blood pressure. It can increase the blood pressure. It can cause the potassium to be low in the blood and may potentiate digoxin toxicity for persons who are taking digoxin medication. عرق السوس الليكوريس صح. Okay, so now I'm done with the first category, which is the natural products. I will move to the second one, which is the mind and body practice. So it includes relaxation technique, meditation exercise forms such as yoga, Tai Chi, and Qigong. And it's widely used by seniors in US mainly both for fitness, relaxation, and perceived health benefits. So the first one is chiropractic osteopathic manipulation. Usually chiropractic are healthcare professionals concerned with the diagnosis, treatment, and prevention of disorders of the neuromuscular system and the effects of these disorders on general health. There is an emphasis on manual technique, including joint adjustment and or manipulation with a particular focus on subluxation. So what about the evidence on chiropractic? It is effective in back pain. It improves pain and function in neck pain and has immediate and short-term relief. As for headache, it's effective only for tension headache. Massage. It focuses on muscles and connective tissues, and we have several types of massage. So massage is helpful for patients who have back pain related to muscle spasm. It decreases stress hormone and it enhances serotonin. So what about meditation? Meditation is a practice that relaxes the body and calms the mind. Usually it has several types. The first one is concentration on a word. If we have time, I got some chocolate to do like chocolate mindful exercise at the end. So pray that we have some time. So concentration on a word, thought, sensation, or image. The second type is mindfulness. It's the intention to notice without judgment the experiences that arise in each moment. And the third part of meditation is movement such as yoga, mindful walking, Tai Chi, Qigong, and Sufi dancing. So there are lots of studies on meditations that showed that it has potential age-defying effect on the gray matter atrophy in the brain. So it helps regenerating some brain cells. And a recent study showed that it has positive correlation between meditation practice years. So the more you meditate, the more you have positive effects in your brain, mainly in attention processing. So meditation has some effect on cancer patients who have anxiety, stress, fatigue, general mood and sleep disturbances. And menopause symptoms, it helps hot flashes, sleep and mood disturbances. It relaxes the muscles and it helps in joint pain. As for hypertensive patients, transcendental meditation, which is a type of meditation, can help also lowering the blood pressure in some patients. So I've put this photo just to tell you that it's not necessary to sit like this to do meditation. You can sit in the street and do meditation. So I will put a short video about yoga. So the first category of mind-body practice is meditation. The second one is yoga.
2 years ago, when I found that my previous form of exercise was not as readily available to me, I started a studio that provides hot yoga and thought I was going to die in the first session. And then after I got accustomed to it, realized that this is a wonderful form of exercise. It allows me to get flexibility, balance, muscle strengthening, meditation. It has an aerobic component to it if you're doing a flow rapidly. It's everything. Typically at home, I start off with downward facing dog, which allows me to stretch all of the muscles, get my body centered. Then I go into sun salutations. That again allows stretching. You begin to move the body a little more rapidly. Then I do a spinal twist that again gets things flowing, and then on to back bends, eagle, triangle. So just about every muscle group gets used. I think that yoga has a number of health benefits, and we have research at NIH and NIA that supports the fact that there's benefit to increasing one's flexibility, increasing one's balance. That's very important in terms of helping to prevent the risk of falls as one gets older. There is benefit in terms of strengthening muscles, also important in falls protection. I think it's one of the best forms of exercise that's available. Some of the conveniences of doing exercise, and in particular yoga at home, are that you can do it regardless of the time of the year and the outside temperature, whether it's too hot or too cold. You can do it with videotapes or to music, or there even television instruction.
Okay. So yoga improves pain tolerance and it affects brain anatomy positively. It has health benefits in back pain. It relieves anxiety and depression. حتى صوتي هدي بعد الفيديو. So just be aware that patients who have high blood pressure, glaucoma, sciatica, and women who are pregnant should modify or avoid some yoga poses. So do yoga with professional trainers. Now I will move to the second part, which is acupuncture. Acupuncture relieves headache, back pain, neck pain, and shoulder pain. So this is what happens usually during an acupuncture session.
Acupuncture has been practiced in China and other Asian countries for thousands of years, and it is one of the key components of traditional Chinese medicine. In recent decades, acupuncture has become popular in the United States. The theory in traditional Chinese medicine is that disease results from the disruption in the flow of vital energy, or qi, in the body. Qi is thought to flow along pathways in the body known as meridians. To remove blockages in the flow of qi and restore and maintain health, Acupuncturists insert hair-thin needles into the skin at specific points on the body that connect with these meridians.
Okay, so we're going to start with the procedure for osteoarthritis of the knee, okay, using acupuncture.
An acupuncture session usually lasts about 30 minutes. The patient lies on a cushioned table, face down, face up, or on either side. Before inserting the needles, the acupuncturist will swab the skin with alcohol or another disinfectant. When the acupuncturist inserts the needles, you may feel a slight, sharp sensation, but the procedure is usually painless. After the needles are placed, they are sometimes gently stimulated by hand or with electricity.
We're going to attach the electrodes to the needles in the Shiyan points.
Okay, so as she mentioned, it's painless, so there is no pain. It's only like sharp sensation. The needles are too fine. And it should be done by experts. Here at AUB MC, we have 2 acupuncture providers that are doctors in the Health and Wellness Center. Okay, as for hypnotherapy, it helps with hot flashes and in smoking cessation. How about Tai Chi? Have you heard of Tai Chi? Yes and no. So Tai Chi is a centuries-old mind and body practice. It involves certain postures and gentle movements with mental focus, breathing, and relaxations. The movements can be adapted or practiced while either walking, standing, or sitting. So this is a 1-minute video about Tai Chi.
Class and instructor, beginner and advanced. A Tai Chi instructor leads a small group in movements that involve stretching and breathing exercises. The group practices slower movements with both arms. The instructor leads the group in an active exercise that involves smooth arm movements combined with graceful steps across the floor. Flowing movements with the arms and body are performed in a lunge-like position. The group practices Tai Chi exercises with brightly colored fans in each hand, raising and lowering their arms in a repetitive pattern. The Tai Chi instructor is shown outdoors, demonstrating more advanced movements. The instructor's motions flow smoothly from one position to the next. The instructor repeats a set of advanced Tai Chi exercises more slowly. And concludes by holding various poses.
Okay. So it is nice, but is it useful? Very useful. So 2 months program of Tai Chi is effective for improving health fitness for the elderly. It has significant benefits on lower extremity range of motion in patients with rheumatoid arthritis. It has favorable effects upon the occurrence of falls in elderly, and it has promising effect on as a complementary therapy for patients with chronic heart failure. So it has the most evidence among all mind-body practices in preventing falls and maintaining balance. It may help to improve balance and stability in older people and in those with Parkinson's disease. It reduces back pain and pain from knee osteoarthritis. It improves the quality of life in people with heart disease, cancer, and other chronic illnesses. It may ease fibromyalgia pain, and it may improve reasoning ability in older people. How about Qigong? اللي مش سامع بالتاي تشي ما حيكون سامع بالتشيكونغ.
Qigong began in China many centuries ago. It is a type of mind-body medicine that combines movement, meditation, and regulation of breathing to enhance the flow of energy in the body.
Down and up, change your finger positions. Index up and middle.
The practice of Qigong is also thought to improve blood circulation and enhance immune function. There are many different styles of Qigong, but they are all based on similar principles. A relaxed posture, a straight spine, breathing from the diaphragm, easy, fluid movements, and a peaceful awareness. Regular practice of Qigong is thought to help clear toxins from the body, improve energy, and reduce stress. If you have a medical condition, check with your healthcare provider before starting Qigong. Tell your healthcare providers about any complementary and alternative practices you use.
Qigong, yeah. So it may reduce chronic neck pain, but studies results are mixed. Okay, so we're done with the second category, which is mind-body practices, and the third one are the non-categorized modalities: Ayurvedic medicine, traditional Chinese medicine, and homeopathy. Have you ever tried homeopathy?
Yes.
No? Okay.
What is homeopathy?
So homeopathy, I will talk about it after Amani. It's not effective in any condition. So I need you to stand up. I need you to stand up. So we're done with the first half of the presentation. Now we're left with only like 20 to 30 minutes max. So I just need you to do some relaxing exercise, just to relax and sit back again. So just a few stretching exercise. Yes, stretching.
You want to explain them on the mic? I can hold it.
No, just stretching exercise. Few seconds, and this is it. There's only one breathing exercise left, and we'll be done. So I need you to take a deep, deep breath from your nose. Yes. Hold it like 5 to 6 seconds, and breathe it out for 8 seconds. Thank you. Okay. Basita. I'll be sending the lecture to everyone, so if you have anything and you feel that you have to leave, then it's fine. So the second part of the presentation, I will go over a few conditions encountered after age of 50. So the first one is the common famous osteoarthritis. It is a degenerative joint disease. Since there is no evidence about them, I will not take much time talking about them. We can talk individually if you want to have more information about these. So osteoarthritis, it's common. It's a degenerative joint disease. It's caused by the breakdown of the cartilage, which is the connective tissue that cushions the end of bones within the joint. It is characterized by pain, joint damage, and limited motion. So far, there is no cure for osteoarthritis, but it's usually treated with only painkillers like paracetamol, Tylenol, and inflammatory drugs. However, anti-inflammatory drugs such as ibuprofen may pose some risk in certain patients. So what are the integrative medicine modalities in osteoarthritis? As I mentioned earlier, practicing Tai Chi may help in managing osteoarthritis of the knee. Acupuncture may help chronic, moderate to severe pain only in candidates for knee replacement surgery, but who can't or won't undergo the procedure. The supplements, glucosamine and chondroitin sulfate, are natural substances found in and around the cells of the cartilage, and they are sold as dietary supplement. They may have some benefits in improving mild pain, but they don't prevent the progress of the disease. chondroitin alone or in combination with the glucosamine, this is a recent study, showed that chondroitin alone or in combination with the glucosamine was better than placebo. Placebo, I mean no medicine, in improving pain in participants with osteoarthritis in short-term studies. The second one is Parkinson's disease. As you all know, Parkinson's disease is a movement disorder that occurs when nerve cells in the brain that make the chemical dopamine stop working normally. The main symptoms are tremor, trembling in hands, arms, legs, jaw, and even face, rigidity or stiffness in the limbs and trunk, slowness in the movement, impaired balance, and coordination. Unfortunately, there is no cure for Parkinson's disease currently, but we have lots of medications and surgical procedures. The surgical procedure is called deep brain stimulation that may help control the symptoms and unfortunately also for a very limited period of time. So studies showed that Tai Chi may improve some symptoms, so such as balance and functional mobility, but study results are mixed. Dance therapy have short-term benefits. Neither massage nor acupuncture appear to reduce symptoms of Parkinson's disease, and so far there is no dietary supplements that can help controlling the symptoms of Parkinson's. How about cognitive function, dementia, and Alzheimer's disease? So what are the cognitive? So what are the functions, the cognitive functions that are thinking, reasoning, and remembering? These are the cognitive functions. Dementia is when those functions decrease much more significantly than what occurs with normal aging. So dementia is not normal aging process. And Alzheimer is the most common cause of dementia. IH, integrative medicine and cognition. So eating seafood rich in omega-3 may help, but supplements don't help. As I mentioned, there is no conclusive evidence that Jinko Biloba is efficacious in preventing or slowing dementia or cognitive decline. No vitamins can help except in cases of vitamin B12 deficiency, then replacing B12 can help improving the cognitive impairment. Music therapy may be helpful for some of the symptoms related to dementia, such as agitation and depression. So can exercise change how our brain works? So this is a very recent study published in 2017. It showed that moderate physical activity may increase metabolism in brain regions important for learning and memory. So the more time spent performing moderate level of physical activity, average 43.3 minutes a day, the greater the increase in brain glucose metabolism. So keep active. How to keep a healthy brain? نرقص نسمع موسيقى شو كمان okay. So the first thing is to take care of our health, to eat healthy food, be always physically active, keep our mind active, and stay connected. Thank you, University for Seniors. ما خلصت عم اقول لكم thank you, University for Seniors, for keeping us connected. Okay, so take care of your health. Check with your doctor routinely, manage your chronic conditions, limit alcohol use, stop smoking, and sleep well. Sleeping well, I'm بحكي 7-8 hours a day. Eat healthy. So healthy diet reduces the risk of many chronic disease, hypertension, diabetes, dyslipidemia. Mediterranean diet consumers have lower risk of developing cognitive impairment. And I have few diet tips. That we should eat diet packed in nutrients and not empty calories. And diet packed in nutrients is rich in vitamins, minerals, complex carbohydrates, lean proteins, and healthy fat. So we should have like 2 to 2.5 cups of fruits daily. The 1 cup equals either 1 cup of fruit, half cup of 100% fresh juice, or half cup of dried fruits. 2 to 2.5 cups of vegetables. It's preferable to have these deep yellow, dark green that are rich in lycopene. Have 7 to 8 ounces of grain food, preferably whole grain, and 5.5 ounces of protein. Protein are meat, chicken, fish, some eggs, and of course beans. 2 to 3 cups of low-fat milk or equivalent, cheese, labne, yogurt, teaspoons of oil, as I mentioned, or equivalent to these servings. And when I talk about oil, then olive oils. Yes, بنصحوا, so they are rich in calories, but they are healthy. So get lots of fibers and focus on unrefined food, whole grain, wheat and rice. Get healthy snacks. For example, whole grain or rye cracker with unsweetened peanut butter is healthy. Popcorn without oil. Include nuts in your diet. Laban yogurt is better than milk. Use olive oil instead of other vegetables. Oil, I missed canola. So olive oil is definitely better than canola oil. Omega-3 fatty acids, eat fish twice weekly instead of taking omega-3 supplements. So the second part to keep our brain healthy is to be physically active. Regular exercise. Regular exercise ما ضروري نتسجل بالجيم. So 30 minutes walking a day may be enough, yeah. So regular exercise keep and improve our strength. We can have more energy, improve our balance, prevent or delay heart disease, diabetes and other conditions. And it improves the mood and reduce depression. So we need at least 2.5 hours of moderate intensity aerobic activities weekly. I mean by aerobic walking, brisk walking, or 1 hour and 15 minutes of jogging or running. Weekly, yes. Weekly, I mean if jogging or running, أكيد إذا ما في contraindication, I mean cardiac contraindications. So keep your mind active by engaging in activities that may benefit the brain. Read books, magazines, play games, or even teach a class. Stay connected with other people through social activities and community programs. How about insomnia? Relaxation techniques such as relaxation guided imagery can help calming the mind and initiating sleep. Music-assisted relaxation for sleep quality in adults found that it has moderate benefits. Relaxation techniques before bedtime are helpful for a successful sleep regimen, and cognitive behavioral therapy may also help. As I talked previously about melatonin, it can help in certain conditions such as jet lag. How about menopausal symptoms? We have little evidence that supplements and herbal products can help. We have a few small studies that showed that black cohosh, it's kind of herbal medicine, may help. Hypnosis may work. Yoga, Tai Chi, and meditation may provide some relief from common menopausal symptoms. Benign prostatic hyperplasia, it's common in men. So palmetto doesn't work. But I mentioned so palmetto because it's popular in US, so I'm not sure if you're familiar with it. If you have back pain and you don't have any contraindication to practice massage, acupuncture, yoga, and chiropractic, then these modalities may help you in controlling your pain. If you have heart failure, consult with your doctor because CoQ10 may help. Hawthorn, تعرفوا شو الهاوثرن؟ بالعربي. هاوثرن. ايه؟ ما بعرف. زعرور؟ زعرور. It has significant benefit in symptom controlling and physiologic outcomes from hawthorn extract as an add-on therapy to the regular medicine. But كمان consult your doctor before taking any medication. So cancer, more recent work in prostate cancer demonstrated that lifestyle changes can even affect the gene expression. I mean by lifestyle changes, nutrition, stress management, walking, and psychosocial support. And studies showed that it changed the expression of more than 500 genes in patients who practiced all of these. Coffee, do you like coffee? Yes. So if you have like 3 to 4 servings of coffee a day and you don't have like any contraindication, I mean uncontrolled blood pressure or any cardiac disease, then you can enjoy your coffee because it decreases mortality due to heart disease, respiratory disease, stroke, injuries, and accidents, even diabetes and infection, but it doesn't affect the death related to cancer, of course. So you can enjoy drinking 3 to 4 cups a day. So in summary, integrative medicine for seniors, the most strong evidence on osteoarthritis is for acupuncture, Tai Chi, glucosamine, and chondroitin sulfate. Cognitive decline, there is no benefit for omega-3 or Jinko Biloba, as I mentioned. And for insomnia, use relaxation technique. So true or false? Chocolate consumption is associated with higher BMI. BMI, يعني fat, more weight. No. Chocolate consumption should not exceed 2 times weekly. But you can eat 1 piece daily. Light cacao has protective effect on coronary heart disease, same as dark chocolate. Yes. And coffee increases mortality, we said no. So coffee decreases mortality. So there is a big study on chocolate that showed that chocolate consumption is linked to less weight, and cacao contains polyphenols that have protective effect on coronary heart disease. Definitely, when I'm talking about coffee and chocolate, I mean in moderation. High chocolate consumption, more than 5 times per week, was associated with a risk reduction, so less cardiometabolic disease and less stroke when compared to low chocolate consumption. So, and I mean both light and dark chocolate. Akid, if you have cholesterol or dyslipidemia, we prefer the dark one, but I'm talking about healthy people who prefer to eat chocolate, then it doesn't matter if it's light and dark on the effect on coronary heart disease.
What quantity?
One serving is usually 2 small squares, 2 small squares. I'm done. I have only a few slides about our health and wellness center, and then if you want to stay to practice a 5 minutes meditation session on chocolate, then you're most welcome. So AUB Health and Wellness Center, we're at AUB MC, and we provide wellness services, and we have an academic and research arm. Our team consists of family doctors, nurses, dietitians. We have 2 acupuncture specialists. We have 1 certified yoga teacher, 1 life coach teacher, and we have a stress management specialist. We have a community health nurse and a coordinator. Our services include general health checkups, executive health checkups, travel health, smoking cessation clinic, employee health services, acupuncture, nutrition, stress management workshops, yoga, meditation, hypnotherapy, and very soon we will have a Tai Chi and Qigong providers. We have consultancy services for schools, corporations, banks, and NGOs, including stress management, ergonomics, nutrition packages, and smoking cessation package. So my home message is to eat healthy, to keep active, even taking a daily walk, as I said, even if your pace is gentle and the distance is really short, the time spent on your feet will help keep your bones strong, keep your brain active, stop smoking if you smoke, and take charge of your health and talk with your healthcare providers about any complementary health approach you are using. So thank you.